Why might you want to give bicarbonate for a tricyclic antidepressant overdose, such as amitriptyline? Amitriptyline is a complex drug with multiple targets: serotonin transporters, noradrenaline transporters, histamine transporters, and as a result it has a wide array of effects, some of them very positive. However, if someone overdoses on amitriptyline, it becomes a problem, largely because of its action on voltage-gated fast sodium channels and alpha-1 adrenergic receptors on blood vessels. These are the main targets that give us the cardiovascular and neurological issues that we see in a tricyclic overdose. So what actually happens? Well, by blocking these sodium channels, it reduces the ability of sodium to move quickly into the cardiac myocyte during a contraction. So much like the sodium channel blocking type 1 antiarrhythmic agents, it slows conduction, it slows that phase 0 of sodium influx, and as a result you get a wide QRS and a long QT and a predisposition, a high risk of ventricular arrhythmias. Now this is a simplified account of course, but it's the main issue, is this sodium channel blockade. The second effect this is going to have, you're also going to mess with your sodium-calcium exchanger, which is responsible for coordinating calcium use within the myocardium. And if you mess with this, you get less effective contraction, and as a result, you get worse cardiac output. So we've got arrhythmias, and in the brain, you'll have a similar thing going on, which predisposes to seizures. You've got reduced cardiac output because your contractility is less good, but because of the calcium mismanagement. And then finally, we add in a blockade of alpha-1 adrenal receptors on vascular smooth muscle, so you're going to get hypotension from this. So you can see it's cardiovascularly quite a sticky scenario. So as always with any toxicology case, you're going to give supportive care, airway, breathing, circulation, disability, as you always would for any case. But why would you use bicarbonate in this situation? Well, amitriptyline is a weak base and it's very fat soluble. It's also highly protein bound at about 96%, mainly to albumin. pKa is around 9.4, which means at a pH of 9.4, half of the amitriptyline molecules are charged and half of them are uncharged. Now it's the charged molecules that are going to bind to the sodium channels and cause the problem, and the uncharged ones are not going to be doing anything. Likewise, those that are bound to protein are not free to have an effect. It's only the 4% that aren't bound that are actually able to interact with the receptor. So, if we could make more of the molecules uncharged, or bind more of them to protein, there would be fewer molecules available to cause these problems. And that's what bicarbonate does. By increasing the pH of the blood slightly, you will reduce how many of the molecules are in their charged state and therefore able to cause problems. And by increasing the pH and making the blood more alkalotic, you will increase the proportion that is bound to albumin, because albumin will bind the drug better in an alkaline environment. So it has this double effect of increasing protein binding and reducing how many of the amitriptyline molecules are in a charged state. And finally, sodium bicarbonate, when you give it as an infusion, is essentially a large bolus dose of sodium, which helps to overcome the blockade by providing a huge influx of sodium ions and help re-establish that sodium channel gradient that's needed for the conduction to work. And that is what helps reduce the risk of arrhythmias and the risk of seizures. So these are the three main reasons why bicarbonate is helpful in an amitriptyline or other TCA overdose.